Okay, we have Sandy Lamb back in the clinic. It's been a while. It's been a while. Sandy's one of our local heroes. She's a police officer, and she's been our patient for a long time. But we started working on your knees last year.
Yes.
And so we did one of our Pinnacle Gold programs on her. She had bone marrow aspirate, and then she had a couple PRP injections. She has been doing amazingly well. She's very active in her job and is a workout person. And Sandy, just tell us a little bit about your experience with our procedures here at Pinnacle and what your pain was like before we started a year ago.
Well, when I came here a year ago, I thought I was fixing to have surgery because I couldn't take the pain anymore, and I felt like that's probably my only option. And then when we started this, yes, certainly in about 2 weeks after I had it done, I could tell that there was a difference. I could do things that I wasn't able to do before, like go down the stairs without holding onto the rail because I wasn't for sure my knees weren't going to give out. And it got progressively better after that. And then I started working out, and that also helped. I recently, just in the past month or so, had a setback with my right knee. Not exactly sure where it even came from, but came back in, and we did it again. And same situation. About 3 to 5 days after that, I started feeling considerably better. Swelling had gone down. Everything that I had started seeing was going away. At your advice, I took about 3 weeks. I didn't do anything, and then I started, trying to work out again. And I have had zero issues with it. If there's any flare-ups, maybe if it starts to swell, all I have to do is just put a brace on it, and I can go on about my day.
I think it's important for us to remember, we do have some osteoarthritis that we deal with when we deal with regenerative procedures, when we do PRP and stem cell, and every once in a while we'll have a flare. And here at Pinnacle, we're not like a normal stem cell clinic where you just take your money and then they never see you again after that first injection. We're a full service wellness clinic, and so we really want to follow our patients. So Sandy's coming in to see us, following up, months after the fact, and if there's an issue, and every once in a while we do have to do a little tune-up. We have the capability to do that, and we're happy to do that for our patients. And certainly for the, we don't take insurance for these things. And for the amount of money that you invest in yourself when you do one of these programs, we want that value to be there. And Sandy, what do you think as far as value? I mean, it's real money. It's more than a couch. We strive to make it worth it. What do you think?
No, I think it's absolutely worth it, because if I hadn't done this, then I wouldn't be able to do some of the things that I enjoy doing. I mean, I'm 52, and there's still things that I still want to do, and so I have to be smart about it. I'm not trying to do things that are out of my scope, but just like the type of stuff I like to play on the lake. I do enjoy working out, and I'm able to do those things. When I first came to you a year ago, I kind of thought that was over until without having surgery. So. As far as being valuable, I really can't put a price on that. I mean, considering, what I said to you that day was, I could take this money and probably go buy a new Sea-Doo, or I can take this money and take care of my knees, and then hopefully still be able to still do that kind of stuff. So.
And it looks from your tan like you're Sea-Dooing. You're out there doing it.
Yeah. Matter of fact, I just bought a new pair. Yes. Yeah.
That's great. So, I mean, and that's our goal, is to give patients as much value as we possibly can. You ready to show off a little bit?
Thank you.
You got anything else to say?
Okay. Yes. No, that's it.
All right. Sandy, stand up for me. Let's do it. So Sandy has pretty significant arthritis. When she came to us, she could not do a deep knee squat. Right. So let's do it. What do you got? How far down can you go?
I can go down.
All the way?
Yeah.
And then can you how far back can you get this?
Yeah.
Awesome. Do the other one.
Whoops.
She's got
You put me on the spot.
All right. Perfectly athletic. Come and see us. We're ready to get you feeling better.